How to become a physician assistant. If you want to learn how to become a physician assistant, you came to the right place. But first, make sure to like and subscribe to our YouTube channel for more anatomy and physiology quizzes and healthcare career content. Physician assistants play a vital role in the medical field. While much attention is given to doctors and nurses, physician assistants are an integral part of the medical teams that administer care. As with many healthcare professions, the physician assistant field is experiencing rapid growth as the demand for quality medical services increases. Becoming a PA is a lot of work and requires a lot of schooling. So we have put together this handy guide on how you can take the first steps to enter this lucrative and noble career. What do physician assistants do? PPAs practice medicine with teams of doctors, surgeons, and other healthcare providers. Like doctors, PAs observes, diagnose, and prescribe medicine to patients and provide basic treatments like setting broken bones and providing immunizations. In some ways, you can think of a PA as a doctor light. They have many of the same responsibilities and duties as doctors, but the profession does not require as much schooling. While doctors and PAs do a lot of the same things, PAs are classified as support medical positions. Common PA duties include taking and reviewing patient histories, examining and diagnosing patients, ordering and interpreting diagnostic tests like X-rays or blood tests, providing treatment, prescribe medicine, perform research on healthcare trends, conduct outreach and education programs about preventing disease and promoting health. Since PAs work on teams of surgeons and doctors, their specific duties can vary depending on the team. Overall, though, PAs provide an important element of main and auxiliary care for patients. PAs work in all areas of medicine, including pediatrics, ER medicine, and surgery, and their duties shift according to the area. For instance, a PA working in surgery may apply sutures and clean wounds, while one who works in pediatrics provides care for children. How much do physician assistants get paid? TPAs employed in outpatient care facilities had the highest average salaries at $115,560, and those employed in local, state, and private educational facilities made the lowest at $102,870. Those in the top 10% income bracket made more than $151,850, and those in the bottom 10% income bracket made less than $69,120. Compared to other medical professions, PAs have very high starting and average salaries. Physician assistant job outlook. The PA field is expected to grow by an astounding 33% from 2018 to 2028, almost 5 times the national average career growth. Since PAs can provide many of the basic services as physicians, many people are opting to see PAs as their care providers, and becoming a PA requires significantly less schooling than becoming an MD. As the baby boomer population grows older and healthcare becomes more accessible to more people, the demand for quality medical services will increase. Physician assistants normally work full-time and often work more than 40 hours a week. As medical professionals, they are frequently on call and must be ready to respond to emergencies at virtually any time. A PA schedule normally includes some nights and weekends. How to become a physician assistant. Step-by-step guide. Step 1. Complete prerequisites, courses, work experience, etc. Becoming a PA is highly competitive and requires a substantial education. Students should start looking into PA programs as soon as they are freshmen in college, so they have the best chance of setting up the right career path. Most PA programs require a basic catalog of prerequisite courses, including courses in biology, chemistry, anatomy/physiology, and microbiology/biochemistry. PA programs usually require applicants to have some experience working in the medical field. Some relevant positions include emergency medical technician, EMT, medical assistant, lab assistant, registered nurse, and surgical tech. Generally, PA programs want students to have around 3 years of experience working in the medical field. Step 2. Attend PA school. EPA programs normally take around 3 years, till 26 months, to complete and award a master's degree upon completion. PA programs focus heavily on the medical sciences and provide students with relevant clinical experience. Some courses you will take in PA school include epidemiology, pathophysiology, pharmacology, microbiology, behavioral science, medical law/ethics, and physical diagnosis. PA must also complete at least 2,000 hours of clinical rotations with an emphasis on a particular field. Fields you can work in include family medicine, internal medicine, OB/GYN, ER, and pediatrics. Step 3. Get your PA license. All states require PAs to be licensed to work. Further, all states require licensed candidates to graduate from an accredited PA program. Each state has a PA exam that is approved by a state medical licensing board. Step 4. Get certified, optional. PPAs can also receive voluntary certification from the National Commission on Certification of Physician Assistants, NCCPA, by passing the Physician Assistant National Certifying Exam, PA&CE. To be eligible to take the PA&CE, you must graduate from a PA program accredited by the RCPA. Candidates can take the PA&CE a maximum of 6 times over a 6-year period. Certification is not required to get a job, but it will help your employment search. Step 5. Renew/maintain license/certification. Each state has different requirements for PA license renewal. In Texas, for example, PAs must update their license every 2 years. Most states require PAs to complete a certain number of continuing education credits to renew their licenses. PAs that hold NCCPA certification must renew their credentials every 10 years, which includes 2 5-year periods in which they must complete 100 continuing medical education credits each period. Let's recap. Here is a quick bullet point summary of what we have covered on how to become a physician assistant. Step 1. Complete prerequisites, courses, work experience, etc. Step 2. Attend a PA program. Step 3. Obtain your PA license. Step 4. Obtain PA certification, optional. Step 5. Maintain/renew your license/certification. Becoming a PA is a challenging field that requires a lot of time, education, and work, but the career is worth it. As a PA, you will be providing essential medical care to people from all walks of life and making a difference in people's lives.